What to expect.
Once you have been checked in and brought back to the preoperative area, your surgical care team will start your IV, collect blood work, review and sign consents, and prepare a surgical site with CHG wipes. While you are in the operating room, family members are asked to wait in the surgical waiting area. In the registration process, there was a transponder placed on your patient identification band. Your family has been given the number that is associated with it. They will be able to see on the monitor in the waiting room where you are at any given time. We ask that the family stay in the waiting area because after the procedure, the surgeon will come out and update the family on how the procedure went. After surgery, you will be transferred to the recovery area where you will awaken from anesthesia and be cared for by the post-op surgical team. Your blood pressure, heart rate, and oxygen levels will be monitored. If you experience pain, nausea, and/or vomiting, your nurse will medicate you per the surgeon's orders. Occasionally, you may also experience throat pain or discomfort. This can be caused due to intubation while under anesthesia. Your doctor may prescribe medicine to decrease the discomfort. If you are to be discharged the same day, you will be transferred to Phase 2 recovery area. Your nurse will assist you to the bathroom, discontinue your IV once you are tolerating liquids, and also provide you with any prescriptions and instructions from your physician. Family and friends may visit you once you have reached the Phase 2 recovery area. It will be beneficial to have a family member or friend present as a second ear for discharge instructions. For your convenience, you may pick up your prescriptions at our pharmacy before going home. PharmaCare is a full-service drugstore and wellness center located in the lobby of Florida Hospital Celebration Health. If you are to be admitted to stay overnight at the hospital, you will be transferred from the recovery room to your hospital room. Your family and friends will be directed to meet you there. As discussed earlier, all rooms are private rooms, and if you prefer, a family member or friend may stay with you throughout your hospital stay. Once you arrive to the unit, you will meet your nursing team. Again, your blood pressure, heart rate, and oxygen levels will be monitored. You will be medicated if you experience pain, nausea, or vomiting. You will receive, as pictured, an incentive spirometer. The nurses will instruct you on its use. This device will help clear your lungs of fluids and prevent pneumonia. You will bring this home with you and continue to use it until you are up to a normal amount of walking. It is important to use the device as instructed to ensure clear, healthy lungs post-operatively. Sequential compression devices are placed on each patient in the recovery room. The device provides massage to your lower legs. The purpose of this device is to aid in the prevention of blood clots through promoting blood circulation while a patient is lying down. The compression stockings, also known as TED hose, are placed on the lower legs to promote circulation. Both of these methods are helpful in preventing blood clots. Another method is ankle pumps. It is the flexion of your foot toward your leg. This contracts the calf muscle, thereby emptying the blood vessels, preventing blood clots. Ankle pumps should be done 10 to 15 times an hour while awake. Not everyone will receive a drain during their surgery. However, if you do have a drain, the nurses will be monitoring closely and record the drainage. Oftentimes, these drains are able to be removed the next day, dependent on output. A Foley catheter is a tube placed in your bladder while you are in the operating room. If you have a Foley catheter in place when you arrive in your room, most often it will be removed later in the day or the morning following the surgery. Some surgeries may require your catheter to remain in place for a longer period of time. Please ask your surgeon what you should expect with your surgery. Some patients need heart monitoring and will be admitted to a telemetry floor after recovery room. The telemetry heart monitor enables your nursing care team to closely watch your vital signs and heart activity during your stay. After surgery, you may experience nausea, vomiting, sore throat, and/or sleepiness. Nausea and vomiting may be due to anesthesia you receive for your procedure. Sometimes patients feel a sore or scratchy throat from the tube used for anesthesia. Anesthesia and pain medications will contribute to your sleepiness. Pain or discomfort may be felt in the surgical site area, and also some patients feel shoulder pain. This deferred pain can be from air used to insufflate the abdomen for laparoscopic surgery. Your surgeon will order medications for your discomfort and pain. Your pain levels will be checked regularly by the nursing staff, and you will be offered pain medication to make you comfortable.